What I love about being a physician and surgeon is the opportunity to have a positive impact on people's lives. The reason that I became a facial plastic and a reconstructive surgeon is because I felt that it was an area where we could really achieve harmony between who a person is and how they look. So this particular field is one where we actually had the opportunity to restore quality of life and make people really feel as positively about themselves as can be. One of the things that I really appreciate about working as a surgeon at Michigan Medicine is the opportunity to be part of an elite team. The process begins with the first person that meets the patient, the shared decision making that I navigate with the patient, and everyone that's involved in the care from start to finish. Increasingly, I've become especially interested in patient safety, quality, and evidence-based medicine because there's nothing that we do in research or otherwise that doesn't really revolve around the patient.